The legitimate medical exemptions are very few and far in between.
A family doctor says patients are still trying to get out of getting jabbed, and physicians are at risk of handing out exemptions based on false claims. Dr. Jessica Chan says doctors feel uncomfortable writing exemption letters without clear guidelines in BC. There are legitimate reasons to be exempt from getting a dose, but they're very rare, and there's clear evidence and records of patients who develop one of two conditions.
You actually personally, like not your friend or not your family, but you personally has developed a very severe adverse event. For example, myocarditis, which is inflammation of the heart, or you have developed allergic reaction, like you got hives, swollen lips, shortness of breath. So those are documented medical adverse reactions.
Dr. Chan wants to see the College of Physicians and Surgeons of BC provide clear guidance on who should get the exemption letters, but they're putting the onus back on the province. In a statement, it says the college defers to Dr. Bonnie Henry and experts at the BC Centre for Disease Control on all clinical matters related to COVID-19, including guidance to the medical profession on vaccines and reasons for vaccine exemptions. The college will ensure that the profession receives this guidance as soon as it's available. Dr. Chan has been looking at the college's Ontario branch, which has published guidance on writing exemption letters. But there are also worries about patients making false claims.
I think what weighs on our mind is the ethical responsibility, because when I write an exemption letter, it doesn't only affect you. As one patient, it affects public health.
The most common concern Dr. Chan sees with exemption requests are from partially vaccinated people. She says they felt sick or know someone who had a rough time after their first shot and are hesitant about getting a second dose.
I welcome those discussions one-on-one with patients, because it actually opened a window of discussion. Like, it help them explore the reasons behind why they don't want to become fully vaccinated.
In Vancouver, Crystal Laderas, City News.